The title of his speech is The Good, the Bad, and the Ugly of Healthcare Reform and Beyond. Please help me welcome Frank Nolimal.
The good, the bad, and the ugly. You're probably wondering why I picked Gary Wolf for that position. Come up here and take a look at him afterwards, you'll know why. Back in 1966, when I was a young 15-year-old, I remembered the movie, The Good, and the Bad, and the Ugly. How many of you are old enough to remember that? All right? The strapping young Clint Eastwood at the time, smoking cigarettes and shooting on the bad guys. How many of you saw him last year in the Scout? He was a baseball scout. How many of you seen that movie? He looks like he's ready for the packing house, huh? He has had some rough days behind him. The handout that you have in front of you here, it's 16 pages, it's called The Good and Bad, the Ugly. I stole his title. When I put together this presentation back in January of 2012, I wanted to bring out to my clients a outline of items that they should be aware of on healthcare reform. And those of you around the table that sell health insurance probably have realized that in June we had the Supreme Court hearing that validified healthcare reform. And then we had President Obama got reelected in November. And after that, there was a lot of expansion and a lot of regulations have come out. So now it's 14 pages. I bring this 14-page illustration onto all my interviews, everybody I go see, because it's an informational piece that, as we go through it today, you'll be able to identify items that might come up in your conversations when you're talking to an employer about group health insurance. By the way, if you haven't heard the official term, it's the Patient Protection and Affordable Care Act, known as, they dubbed it Obamacare. Respectfully, I'm going to call it the Affordable Care Act through my presentation, but it is law. We're moving forward with it now, and what I'm going to attempt to do is go over the good and the bad and the ugly of the law. The first page is pretty easy, very evident. These are items that are already have taken place. In fact, some of them went into place as early as October of 2010. And if you're under an employer group plan right now, these are the benefits that are already in there. Your insurance companies have removed all the limits, the internal limits on the plans, and there's essential benefits that are listed in programs. Children under 19 are not subject to pre-existing conditions. In the old days, they were, along with the adults. Children can now be left on their plan until they're 26. This is probably the biggest commercial item that came about. There was about almost 2 million kids that were brought back onto their parents' plans. Great idea. Many preventative services are now provided at no cost. I joke around when I do benefit meetings and tell people you can actually get a colonoscopy once you're over 50 years old under preventive health care for free. Are you ready? Nobody ever rushes out on that one. And item number 5, you'll notice that there's in red ink a little change, and I'm going to go over it. Up until the 16th of February, many states, including Nevada, residents were eligible for what they call the PCIP, the Pre-Existing Condition Pool, which was part of the Affordable Care Act that said this: if you are a Nevadan uninsured for at least 6 months and you applied for health insurance and were declined by any carrier, you merely were able to go online to pcip.org and get insurance on a guarantee issue basis with no pre-existing conditions. End of story. Out of clear blue, a couple days ago, we received a notification, and some of you that are sitting around the table may have seen this from NAHU, the Health Underwriter Association, that the plug was pulled. The HHS has discontinued this plan for new participants. Those of the people that are under the plan are still going to be eligible. Their plan will continue till the end of this year. But the bottom line was, and I predicted this several months ago or several years ago, they ran out of money. That's the bottom line. The losses were horrific. The number I have, and I have some statistics here which I won't go over, 4% of the employees, or 4% of the enrollees utilize 50% of the pot of money for claims. And that's pretty standard in the industry as far as excess coverage. Second part of that page, we talk about additional good that's coming on January 1st. all Americans will buy their insurance through a state-run exchange. In about 15 minutes, I'm going to introduce Bill Wright to you, who's going to talk to you about the exchange. But if you haven't heard about the Silver State Exchange, it is Nevada's way of providing all people in Nevada a way to go online and buy insurance from the Aetna, Anthem Blue Cross, Cigna, Sierra, you name the company, they will have an individual plan that will be sold on the exchange. The rule is guarantee issue, no pre-existing conditions. January 1st, your coverage starts automatically. And certainly those people that are on the PCIP plan today will go on to that plan once that begins. Second point is many Americans will receive subsidies from their states toward their insurance if it's bought on the exchange. On the next page I'm going to get to in just a second, it shows you the number of credits that you'll be applied for, that you'll be available for if you are at a certain income level. But before I change to page 2, let me finish with page 1. Medicaid. Have you all heard of the word that they're going to expand Medicaid? Right now, Medicaid covers the truly handicapped, mentally, physically handicapped, single women with children that are under the poverty level, which is about $11,800 right now. You can get free insurance, free everything. It's covered. As of 1/1/14, listen to this, 1/1/14, if you are an able-bodied person in Nevada, that number is going to be moved up to $15,500, which is approximately 138% of poverty level, and you get free, no copays, no deductible. You just get free health care delivery if you're earning under $15,450 a year in income. A family of 4 is going to brings it up to about $32,000. Below, you get free everything. All right, that's what they call the expansion of Medicaid, and the governor has signed off on it that they are going to be expanding Medicaid in the state. Now go to page 2. I promised in the first page I was going to tell you a little bit about the credits. This report was published by Anthem Blue Cross about 1.5 years ago, and I give them the credit for putting it together, and in about 3 or 4 months we'll have the exact numbers to put in here, but it was their underwriter's prediction that this is what it's going to look like as far as a credit. The top illustration is a 25-year-old male, and you can see based on the poverty level how much on the right-hand side their premium will be net after the exchange credits. And as you go closer to $40,000, it drops off. The illustration on the bottom, you'll see that a family of 4, same concept. If they're at the top level, they're only going to pay $76 for their insurance, going up to the $1,180 for their insurance. So far I've gone over the good of what's happened. A lot of this has happened already, and several other items are going to schedule for January 1st. What I want to do now is go to the page 3 and go over the bad. With healthcare reform starting in January, and Bill will tell you a little bit about the exchange, there's going to be some changes of underwriting. Those of you that sell life insurance or disability know what underwriting is all about, but here's the 2 big changes that are going to happen in the healthcare industry. Today, an old guy like me, who's 60 years old, my rate is here, and they could charge the 18-year-old 6-to-1 premium. So my premium could be 6 times what the 18-year-old is going to be. That's all being changed to a 3-to-1 ratio. Hey, I'm pretty excited about that. My rates are going to go down, right, Bill? But the problem is the young group, the folks under 30, rates are going to go up substantially on that. And the second item that's going to happen in healthcare is that we're going to have guarantee issue, no pre-existing conditions if you go to the exchange. Well, picture this. I have to have bypass surgery tomorrow. Not really. And I wait till January 1st and I get the insurance. The coverage is automatically in effect, and I go in and have my $80,000 claim submitted, covered by the health insurance. So those 2 items are going to drastically push up the rates, especially for the young folks. And the illustration here on the left, on page 3, you have a young 25-year-old based on Anthem Blue Cross rate. That young man could buy a $2,500 policy for about $118 a month. That rate will go up to $257 a month. Now keep in mind, these are approximate rates that were given to me about 1.5 years ago. We'll have the actual rates off soon, but from what the commissioner has told us at different meetings, this is pretty accurate. Going down to the second example, the young family of 4, that rate today is $674. That will go up to $1,086. Now keep in mind, there may be some applicable credits that will be applied, but those are what the rates are going to be. The other part I put on the very bottom on the underline note, in Nevada, no carriers are selling individual health insurance to kids right now. On October of 2010, when the pre-existing condition had to be wiped off the slate, every single carrier in Nevada left the individual market for kids at under 19 years of age. We have no insurance company that will sell a youth insurance. Kind of an unintended consequence of the healthcare law, and that has been troubling to a lot of customers. I get calls from my customers, my grandparents that want to take care of their kids. It's not available to them. On page 4, there is an example of group insurance. You're going to be hearing from Bill Wright from the Chamber shortly. He does a lot of small group. This is the effect of the community rating and the guarantee issue that's going to occur to small group. Same type of example today, a young, healthy group that's now paying $147 a month for their $500 deductible with most carriers. You can see all the add-ons as you go through. The premium pretty close over doubles for that person. So we're going to see that. I left off, on the contrary to that, there are groups that are old and sick right now whose rates will actually come down. They will. The old and sick groups will come down, but the young and healthy groups are going to go as much as doubling effect. On the bottom of page 4, you see the penalties. I won't go into those right now, but if a person says, I'm not going to buy the insurance, these are the penalties that apply in the first 3 years. I stopped for a second and asked this question. How many sell property and casualty or auto insurance? Can I see the hands? Here's the quiz. How many Nevadans drive cars right now without car insurance? Somebody heard that. I heard 17. That's exactly right. That's the average daily non-insured motorist in Nevada. How many would bet that most of those are under 30 years of age? My point being, and I'm having fun with you now, I have a problem. I feel that we're going to have the same issue. If they're not buying the insurance today, rates are going to go up for those young people, and even with some subsidies, they're probably not going to buy it anyway. And that example of the car is you have a lot of young single people that don't buy car insurance, and that's going to be the same problem. Next page, we get into the ugly piece, and this is where I expand a little bit to Medicaid. Talked about on the first page, some estimates are as high as 304,000 people will be eligible for free stuff, free health care here in this country. There are two thoughts here. This is an excerpt from the very conservative Nevada Public Research Institute. And during the first 3 years, the federal government is going to absorb all the additional costs of this health care for expanded Medicaid. That'll be by the federal government. Of course, you and I are still taxpayers. We're still going to be paying for that. The issue is going to happen in 2017 when about a 10% corridor is going to be passed on to Nevada taxpayers. Folks, this group is estimating that there will be approximately $5.2 billion shifted on Nevada taxpayers over the following 7 years, from 2017 to 23. And if you've been watching the paper recently and see all the cutbacks at Clark County School District, cutbacks to the university systems in this state, this is going to be a battle fought in Carson City 2 years from now, because it's already been expanded. The budget will have to be changed for the 2017 year. Watch your papers at that time. It's going to be huge. I also added, there was an article, following page on page 7, and this is just a little fun thing I threw in. Back in August, there was an article in the Review Journal. This was a statement made, interview made by the Health and Human Service Director of Nevada, Mike Wilden. I'm not going to read through the whole thing, but look at the title. After all this money we're throwing at the exchanges, Bill shared with me, so far we've got about $74 million invested in the exchange. It hasn't even opened yet. He's saying that even after it's all done, there still will be 10% of Nevadans uninsured. And that's coming from the Health and Human Service Director here in Nevada. Next 2 pages, and these are not numbered. In fact, these are so new they don't have pages numbers on the bottom yet. And I want to go over this. This is good resource when you see your clients. Page 1, the first group is your small group. You'll see on the top left, you'll see the word underlined small group employers. And the second page is going to be for the large group. No secret, this is Health Plan Nevada Sierra's insert that they've given out to their agents and their customers. But I highlighted, and when I go out to my customers, I want them to understand that when they get their renewals starting soon, that there are going to be fees and taxes applied. And you can see here, if you just go through the highlighted ones, you're going to see small groups. Again, somebody said this earlier, I think it was Mahesh or somebody, that there's about a 4% tax that will be added onto premiums next year. And of course, on the small group, the community rating, that will have really the huge effect on health insurance premiums next year. On the second page, it talks about the large group. They will have the applicable taxes applied, approximately 4%. Good for them that they will not have the community rating. My final 2 pages, under page 11 and 12, which again are out of sequence right now, when you're meeting with a client that's either 50 employees or less, or 50 employers or more, these are the questions or the comments I would make when you're going through an interview process like that with them. If you're less than 50 full-time employees, continuing offer qualified plans, carriers will be continuing to sell it. The commercial carriers will continue on. You'll have the same new taxes and fees applied, and you can keep your insurance. Or, 2, you can completely discontinue your insurance. There will be no penalties assessed to groups that have 50 or less full-time employees. So you can just say, I'm not buying insurance anymore for you. I'll give you a 50-cent an hour raise. Go get it yourself. No penalties are applied. The purchase of group health insurance will be done, can also be done through the state exchange. Bill will talk to you about that in a second, where you'll be able to get subsidies for some of those employees. And we might see the cropping up of small association plans that might help reduce rates. We'll probably see that. I will tell you right now, if you have groups that are on the professional end, CPAs, accountants, attorneys, architects, they'll probably keep their plans because they want to retain those employees. But when you start adding in like landscapers, service industry, those are the people who will probably be dropping their insurance. And then on the final page, employer groups of 50 or more full-time employees, you can see here, they will continue offering qualified plans through a commercial carrier, paying those new taxes. Many of them today, I'm talking to them right now, are starting an aggressive plan to remain under 50. They're at that 48, 47. They are shutting down right now. They'd rather pay overtime than go over, because the test is done this year as to how many people you have as January 1st rolls around. Here's one: offer a qualified defined contribution plan. Those of you in the pension business know what I'm talking about. It says defined contribution plan. It's where you pick a flat dollar amount and give everybody $100 or $125 or $200 a month for their insurance, and then they have a series of 1, 2, 3 different plans to pick from. As I point out in this item here, is that I predict that all carriers for the larger groups will be coming in with what they call the very low qualified mandated plan, called the bronze plan equivalent. You'll have about a $4,000 deductible, $8,000 out of pocket, and that premium will shift the premium down about 60% or 40% to 60% less than what the better plans are paying right now. So that employee can buy that for almost what the employer is offering in cost. And the other thing different in health insurance, those of you selling pensions have heard of the word controlled group, where Bill and I own a company together, and you have to offer Bill's employees and my employees pension plans. That will now be in the health insurance business. Controlled groups start 1/1/14. So if you know any employees that say, employers, oh, I've got 5, I've got 15, 20, we're partners, but we have all small businesses, but we kind of jointly own them, let them know that they're going to start aggregating all those employees, and the number will be 30 hours or more. You'll be able to get insurance if your employees are at 30 hours. So keep that in mind as you go through. I hope everybody everybody should have one of these in front of you. Take them with. They're great resources as you go out to your employers. I'll be here for a few minutes afterwards. I have been given the duty to introduce our next speaker. Our next speaker has been in the insurance business in town 30 years. 30 years! You look like you're 40 years old, Bill. He was with an agency that was owned by a good friend of mine, Bruce Lane and Associates, who later became Brown & Brown, and worked for them for several years. In 2011, Bill became the president of the Chamber Insurance Benefits, the Chamber Health Plan, and he and I have become good friends because we talk all the time about what's going on in the industry. Bill is one of the 4 agents in the entire state that are on a committee for the healthcare exchange, the Silver State Exchange, and he will now wrap up and maybe connect some of the dots about the healthcare exchange. Help me welcome Bill Wright.
Thank you, Frank. Or should I say Clint? You know, a few of us that are in this room today, Frank being one of them, me, Dwight Mazzoni, I saw Bob Bishop in here earlier, were invited to be on a panel of the Southern Nevada Health Underwriters Association a couple of months ago. The people that attended that were invited to submit questions, which they did, and the first two questions that came out were, what is an exchange and what is the Silver State Exchange? Well, an exchange is a marketplace. It's a place, as Frank said in his talk, where you can go buy insurance. The Silver State Exchange was developed in a response to the Patient Protection and Affordable Care Act, which says states have to have exchanges. Well, today, not all the states have chosen it. 18 states in the nation have said we will do exchanges. They range in completion from ours, which is probably as far along as any, to places like Idaho, who have been approved to do an exchange, but are still talking about it in their legislature. They don't know how to do it. They haven't received any federal development grant money. They haven't done anything. So we have two exchanges in this state as a practical matter. We have an individual exchange. That's for the people who may not qualify for the Medicaid expansion, and we have what is called the Small Business Healthcare Options Exchange. I sat on the committee to develop those two exchanges. Effectively, the third part of the third leg of this whole issue is the expansion of Medicaid that Frank referred to. And we'll talk about that again in a minute. Keep in mind, these exchanges, particularly the individual exchange, is like an A-B flow chart. If you don't qualify to get a subsidy to go into the exchange, you qualify to go into Medicaid. Those are the two places that you go. So the creation of the Silver State Exchange is mandatory under PPACA. There's a state exchange. There are national exchanges. 26 states will go into the national exchange. Seven states will go into a joint partnership, for lack of a better term, with the federal government to manage their exchanges. That's probably going to work great, don't you think? I always like the feds as my partners. So how much did the exchange cost? In the state of Nevada, so far, the exchange has received $74.7 million in federal development grants. Nationally, $3.5 billion have been given to the states in federal development grants to establish the exchanges. That's 18 states, $3.5 billion. Other money. How's that $74 million in our state been used? Well, our exchange has 9 employees. They have offices. They have travel expenses. They also have to promote their exchange. So to promote their exchange, they hired a firm called KPS3 out of Reno. The grant for that was $6 million. $5.4 million of that will be spent by KPS3 to promote the exchange between now and March 31st. In addition to that, they needed to have a back office. They only have 9 people working at the exchange, so they had to have somebody to manage all of the hundreds of thousands of applications that they're expecting. Right now, they have a contract with Xerox Corporation for $72 million. That contract is a 4.5-year contract. The first 2 years of it, and first 2 years and 3 months of it, are guaranteed by the federal development grants. After that, it becomes the state's responsibility for the remaining $35 million. In this case, our governor has said he will not provide any additional general fund money, so the exchange is responsible for it on some level. The exchange budget, by 2017, the executive director is projecting that his budget will be $25 million a year, of which $13 million goes to consulting fees such as the Xerox contract. So it's a lot of money, and it's all federal development grant money, all taxpayer money. So what are the goals of the exchange? Well, right now in Nevada, you've got 567,000 uninsureds. The number that the executive director put out initially as his goal for the first open enrollment through 2014, March 31st, 2014, 146,000 lives, of which 3,000 would be in the shop exchange, the other would be in the individual exchange. Well, that's been reduced. Right now his number through the first open enrollment is 116,000. So we're effectively spending $74 million to insure 116,000 people. I'd have bought them an insurance policy personally, but you know, it's not my choice. So, second problem comes up with the exchange. I put an article out there for you to read. It's called Federal Rules Limit Aid to Families Who Can't Afford Employers' Health Coverage. If you look at the second paragraph of it, it says that only the employee will be eligible for the subsidy. His family will not be eligible for the subsidy. If you skip to the last paragraph of that article, this is a New York Times article, it also appeared in Washington Post and Wall Street Journal on January 30th. That article says that there will be 30 million people remaining uninsured in the United States, down from 37 million when we started. So I'm not certain we've accomplished exactly what we wanted to do. And this was an IRS ruling that came out on the Wednesday before this article came out. Kind of a tragic issue. So let's talk about Medicaid expansion for a minute. The original numbers, we had Mike Wilden in our office 2 months ago, Frank, wasn't it? Mike gave a speech to our healthcare committee, and he said there are 317,000 people in the state of Nevada that have Medicaid right now. His number for possible expansion was another 77,000 people. 3 weeks later, he was quoted in the Las Vegas Sun saying that the new number was going to be closer to 170,000, taking the total to 490,000 by the end of 2015. That's 25% or 20% of the state's population that will be having Medicaid. So, Frank, I think your numbers might be low in terms of what it means. Big question that comes in, and you folks are going to have to deal with this to some extent. What about the physicians that treat another 190,000 people? Where are they going to come from? So what products will the Silver State Exchange offer? It can offer health insurance. It's the only thing they're empowered to do right now under the law. What do they want to offer? They want to offer dental and vision. They also have to offer, under the law, they have to offer children's dental. So right now there's a bill draft request, BDR 1285, that has been presented. That says that they want the right to sell supplemental coverages in Nevada. What does supplemental coverages mean? Well, they said supplemental coverages, supplemental to the health insurance business. I think that's right, isn't it, Dwight? Pretty close. I have no idea what that means except anything they want to sell. That gives me a little heartburn with the broadness of that language. So we'll see how that turns out. I know my organization is rendering a response to that BDR, and I suspect that the other agents associations may wish to do so as well. So going on with how do we deliver this? Well, right now they want agents and brokers to use. They want to use agents and brokers to some extent. I'm not certain that the market that they are after, which is primarily the uninsured disadvantaged market, is one that any of us have ever really firmly gone after. Hard, cold facts of it. But that said, they also have these things called navigators and assister enrollers. Okay. They've got a budget for those folks. Part of it's federal development grant money. Part of it is required to be paid for by the exchange out of their general fund. For navigators, thanks Dwight for the numbers this morning, navigators, $370,000 a year. That's paid for out of the budget of the exchange. Enrollment assisters, $1.2 million a year. That comes out of federal development grant money. And that was originally all going to have to come out of the exchange budget until the exchange found a way to circumvent some particular rules. So the cost to consumers. Frank mentioned this isn't going to be free. By the end of 2015, the exchange has to be self-supporting. How are they going to do that? Well, they're going to charge per head per month or per member per month fees. Right now, those fees are targeting in at some place, we're going to say $6 plus or minus per head per month. As I said, the budget is $25 million. He's going to spend $25.5 million. By he, I mean the executive director of the exchange. That's a lot of money. He's not going to be self-sufficient according to the pro formas that he has published. So we'll see. In terms of the fees, and I I put another handout on your table there from the American Action Forum. I got this from a lobbying group who I trust a lot, since we happen to pay them at the chamber. And it shows you the national implications of what Frank was talking about in terms of the rate increases. And if you go to the back, there are 4 tables that really show how each of the rating factors that we have gained and lost affect the rates that all of us are going to be paying. And essentially it says that for young, healthy people, young, healthy groups and individuals, they're going to see average rate increases nationally of 169%. Old gray guys like Frank are going to see average decreases of 22%. And they give a significant amount of justification on how that's going to work. It's an interesting document. I include it only for your information and because I found it interesting. So what's it all mean? It means that we're going to have an exchange in Nevada. It's going to be implemented starting 1/1/14. The first open enrollment for that date starts on October 1st, 2013. It will be handled by navigators. In theory, it will be handled by brokers. There is also a web portal. That web portal will be designed for anybody with a computer to go in and try and enter enough information to get a quote out, to try and decide which of the many hundreds of plans that could be in that exchange they may wish to choose from. Personally, I go to the grocery store and get confused in the cereal aisle, so if I see 50 plans on a website, I'm not certain it's going to help me a whole lot. So it's just going to be a very difficult and trying time in the health insurance industry, and we're all anxious to see how it turns out. Frank and I'd be happy to answer any of your questions if you've got them. There's a lot of them. Yes, sir. Under community rating, none. Oh, the question was, if you don't wish to be part of community rating, if you don't wish to be exempt from underwriting and have guaranteed issue, what are your options to do that? And the answer is, under community rating, adjusted community rating is the full name of it, there are no options. That is correct. And now it's a different conversation if you're working for an employer with more than 50 employees. And we haven't even talked about that because it's really a whole separate conversation about the obligations and requirements of those employers versus the employees.
I want to add to his question about individual policies. The only reason a person will want to go on the exchange is to get the credits, the tax credit subsidies. If you're over about $45,000, you will not be eligible for any. The question becomes, well, do you have to go to the exchange? The answer is no. All of us around the table that have health licenses will be able to continue selling the products, but they're all going to be community adjusted. So all rates are going to go up, whether you go on the exchange or you're not. And I think you told us that that $6 fee they're talking about, they're going to spread it to the business Joe writes or Gary writes on individuals outside the exchange to recoup dollars, which is really too bad. Everybody's going to subsidize it. Wait. We got a ringer in the audience.
Oh, here, you take that one.
What I've understood so far, how do the agents get paid? Gary will still have his contract with Sierra Health Services. So if somebody goes on the exchange and uses Gary as the agent, he will get a credit just like he's getting now for an individual policy. Commissions will be paid to Gary through the exchange. Likewise, if you're with Aetna, you're buying an Aetna policy. If you're by the carrier, I'm sorry, yeah, by the carrier, you'll get directly from the carrier. I'm sorry, I misunderstood. You will continue getting your contract and paid through the carrier, not the exchange. You guys look like deer in headlights right now. I give this example. My daughter, who's 25 years old now, has a golden rule $1,000 deductible, $172 a month with copays, drug card. If you look at the example, that rate's going to go into the $350 range. And the only reason why Amanda's got health insurance is because I pay for it. she makes more than the subs. Yeah, absolutely, she does make more now. I got to talk to her about that, Bill. Yes, Frank. Great. Frank asked the question, do I see my business going down because of healthcare law? That 12 pages I just handed out, I wrote 15 groups last year, new businesses, because people out there are starving for information. I cannot tell you how many people, and I hope I have not taken any of your businesses away, but when I start this conversation, I start talking to them about the law, and they go, oh, I don't know anything about that. Explain that to me. You whip this thing out, and it's a great reference piece to start talking about. Bill alluded to this before. When we did this health underwriter meeting, it was deers in the headlight. He was Bob Bishop. Bob predicts that probably a third of the agents will be gone in the next year. They're selling health insurance, primary health insurance products only. And that's because the carriers are going to need to have people, just like Joe handles estate planning right now. He knows the tax laws. That whole bunch is going to be pushed onto our health insurance community now, that they're going to be a lot more, have to be more on top of the whole changes that are going on in our industry. So actually, I've taken the opposite approach, and I've done very well with adding new businesses just because of that. Agents are leaving the business as we speak. I am primarily in group business where we're able to dial in a lot of the commissions on the larger stuff, very small amount. Those of you selling individual took a big hit last year, 2 years ago. Most of the carriers dropped it by 50%. We were very fortunate that our service renewals remained pretty steady. Our biggest hit was the economy in Las Vegas, and I'm sure everybody had a hit there. Dwight. And realize with minimum loss ratio, those of you that are in the group business, have you noticed that some of the carriers have let go their sales manager, CRL Services, large group? You see that happening. They are going to be depending on full service agencies all that much more. So be aware of that.
For those of you that sell property and casualty, and some of you know that's my background primarily, the insurance companies always limited their exposure in the market to a small number of agents that they established firm partnerships with. I'm not saying this is going to happen for sure, but I would not bet against the fact that the health insurance industry will be forced to take a similar position and have a limited number of good, strong, solid partners in the marketplace. And those people that don't develop that and don't have a lot of business with them are going to be in some jeopardy. Yes, sir. That's right. He's asking that if you don't buy insurance, that there's a penalty that you have to pay. The rest of the question was the mechanism for collecting that is through a tax refund. The answer to this is yes, the short answer. The first year, if you don't buy insurance, the penalty is $95 or 1% of your adjusted gross income. Second year is $295 or 2% of your adjusted gross income, and the third year is $695 or 2.5% of your adjusted gross income, whichever is greater. Now, the only way to get that is when you file a tax return, assuming you file a tax return. What is it, 40% of the people in the United States don't file a tax return? And they're probably the ones that don't buy insurance. So the only way that the IRS picks up the taxes is to withhold it from your refund. And ultimately, I guess if it gets to be a big enough number, somebody's going to come knocking at your door or whatever. But yes, you understand it correctly. Yes, sir. The question is, and I'll paraphrase, Mark, if it's okay. What's the incentive if you're young and healthy to not just stay out of the system until you become sick and need the insurance? The short answer is there is no incentive for you to buy insurance, other than there will be open enrollment periods, which the first one is 6 months long. So, but you won't have a free window, but it's going to be a fairly long window to get in. Yes, ma'am.
I was the one that brought that up. Specifically, I was talking about certain service industries that are not providing health care for their employees right now. All right, they're not providing it. No, no. What I'm saying, if they're not offering it now and they're under 50, they will probably, it'll stay the same for them. Now, if you're over 50 and you're not offering insurance, there's going to be a way of getting around it, and here's how it's going to happen. First of all, I'm already seeing some of my service industry. Who's eating at Metro Pizza here? Everybody know Sam Ficini is a good buddy of mine. I've insured him for 25 years. They're already figuring out on their waitresses and waiters and bus people to go into under 30 hours a week. 3 days a week they work for Sam, and then 2 days a week they go to a Greek restaurant next door and work for them. They still go to 5 days, but they're working on stuff like that to keep them off of the 30 hours or more. That's how they're going to get around something like that. And also, that second level plan will be introduced. It's the bronze equivalent. This is the $4,000 deductible, $6,000 out of pocket. The rates might be $125. They'll offer that as the base plan, and then you can buy up. It's noted in my last page of my illustration. That's what I think is going to happen for the groups that are larger, that can't get out of the 50 or under. That's what they'll be doing. All right. All righty. It's been great.